Hi, my name is Travis Vermilye. I'm an assistant professor of medical illustration at the College of Arts and Media at the University of Colorado, Denver. I'm going to talk to you a little bit today about a project that I'm working on right now. And the title of the presentation is Illustrating the Image of Health. So I'm a medical illustrator, and a lot of the work that I do is working with medical professionals or working with biology professionals, or in this case surgeons, to either illustrate a tool, and as the case may be here, where I'm showing how this particular device is used and how it's beneficial to minimally invasive heart surgery. So this series of illustrations shows how this actual device works. So a lot of the work that I do is geared towards a client and is designed to work more in a commercial standpoint. So this is another example of the work that I do. So this is illustrating a surgical procedure that a surgeon at the at the Children's Hospital in Colorado performs. So the surgeon uses particular steps, and this illustration, or this series of illustrations, shows those steps and how he performs that surgery. Another example illustrating a heart valve. So I find myself wanting to do things outside of the client realm and the what is traditionally considered medical illustration realm. Occasionally I get the opportunity to do that. One example is this animation, and I was able to work with one of our film professors at the university on a documentary about tuberculosis. And so this documentary shows how our body deals with tuberculosis. And this is getting a little bit towards the area that I find myself drawn to and find myself wanting to work more in, and that is artwork in the service of the public and more for public education. So this piece shows a macrophage, which is a white blood cell, has just ingested tuberculosis, and it's coming from inside the air sac, the alveoli of your lungs, and making its way to a lymph node or a lymph vessel. So once inside the lymph vessel, it's traveling down the lymph vessel towards a lymph node. And because tuberculosis is difficult for the macrophage to destroy, it actually the macrophage dies, the white blood cell dies, and the tuberculosis bacteria are released into the lymph node. After this happens, like chemical signaling calls other macrophages in to do the same job again. Now the body senses this and decides, hey, we need to do something about this, and it tries to enclose these macrophages and actually enclose the bacteria. However, from time to time, one of those macrophages may get out and make its way into the bloodstream. So our body's made this granuloma, this ball of cells and tissue. However, one of the cells gets out, and eventually that macrophage will also die, releasing tuberculosis bacteria into the bloodstream. And that's how we contract tuberculosis. I still feel this need for something more, so I feel like I want to find some way to push my work further and push it in the direction of helping others. Not only that, but get away from traditional medical illustration and into a few different areas. So I've sort of come up with this way to combine different areas that I'm familiar with. One of those areas is medical illustration that I've already covered. Another area is editorial illustration. So in the medical illustration field, we sort of see illustrations that tell a story through imagery, more traditional types of illustration. We see that as called we call that editorial illustration. So this is an example of that I've created. So memory loss or Alzheimer's disease and old age is the theme here. So you can see that older files such as the past are full of documents, and newer files, yesterday, today, last week, are missing files. Some file folders have no documents, some have many. So this is an example of sort of editorial illustration that's telling a story. Another area that I'm interested in is data visualization. And data visualization is essentially the graphical representation of numerical data, or the visual representation of numerical data. So on the left side, we're seeing an example from the New York Times that shows box office hits. So left to right is time, up and down is income, or ticket sales, box office receipts. So we can kind of see, based on the width from left to right, that each movie that's come out is in the box office about the same time, regardless of how much money it actually makes. It's in the box office at relatively the same amount of time. So you can really gain a lot of information. You're not only getting a timeline of when movies have come out, but how much money each movie is made. And on the bottom, we're seeing an example of Hans Rosling's Gapminder software. And if you haven't seen his TED Talk, I highly suggest you go onto TED.com and look at a few of his talks. He really does a nice job of representing data over time. So my work now is about taking these three areas, these three sort of unique areas that are maybe somehow related, but only loosely, and combining them into something else. So having this in mind, I came across some data from the U.S. Department of Health and Human Services. Specifically, I came across, on a different site entirely, something that mentioned the number of people waiting in line for a kidney transplant versus the number of people that actually receive kidney transplants each year. And the numbers are staggering, and I think the numbers are really representing something about our health system and our health society. And this data is entirely in the United States. So you can see by this, people on the waiting list, kidneys, as of September 2011, there are almost 96,000 people waiting for a kidney transplant. And in 2010, as well as 2009, the numbers were roughly similar. Only 16,900 of those people actually received a transplant. Same thing with the liver. You've got almost 17,000 people waiting for a liver, and only 6,000, a little over 6,000 are going to get that liver. With the pancreas, we're looking at 1,370 people waiting for a pancreas, and in 2010 only 350 received that. So if you want to check out the data yourself, I've provided the website on the bottom. But this got me thinking, this is a way that I could sort of use this new technique that I'm thinking of. So for an inspiration, I drew a lot of my inspiration from Chris Jordan's work. And again, if you haven't seen his work, I'd really strongly suggest you go to his website and check it out. It's chrisjordan.com. So this is an example of the work that he's doing, and I think it's a good example of combining two of topics I've talked about, which is data illustration, or data visualization, and editorial illustration. So we're seeing an example of an image in the background that's reminiscent of sort of pointillism. I'm thinking of the Luncheon on the Grass painting. But on the right, what you're seeing is a zoomed-in portion. So what he's actually done is taken in Photoshop or some image editing software and used 32,000 Barbie dolls to create this image. And that equals the number of elective breast surgeries performed in the U.S. monthly in 2006. So it's a pretty staggering number, and I think a pretty powerful image. Another place I drew inspiration from is the idea of the labyrinth. And this comes from not necessarily the religious views of labyrinths, but more the Zen meditation view of the labyrinth, where the labyrinth represents journey. And this got me thinking about the journey that people waiting for this transplant, not only the people that actually get through all the way and get their transplant, but the people that are just waiting and never receive it. What their journey must be like, and what that means to them, and what that means to us as a society. So keeping these things in mind, I've come up with this method of displaying that information. So this is the image that I'm calling the Renal Labyrinth, and again you can see the data at the bottom. So essentially 1 in 5.6 people that are waiting in line for kidney transplants are actually receiving those transplants. What is that saying about our health system? What is that saying about our health as a society? Why do so many people need these transplants? And can images like this, displayed in perhaps a gallery setting, or perhaps actually in a hospital or in a clinic, in schools, can these sorts of images, with the data associated, maybe in a loose way through a label or something like that, can this sort of imagery help change people's minds, or at least make them become aware of issues in our society? So I sort of, another inspiration I drew from is surrealist painting, specifically Salvador Dali. I've always been a fan since I was a teenager of Salvador Dali's work. Back to this image. So in this particular image, because the numbers were so large, each symbol represents 100 people. So and I've actually counted out manually and placed them in the pathways. The thing about a labyrinth is the difference between a labyrinth and a maze, if you're not familiar. A labyrinth only has one way out and one way in. And the whole entire idea of the labyrinth is that you're getting to the center. And the center of the labyrinth represents journey, represents making it through this ordeal so that you can think quietly and meditate. And I've sort of changed the meaning of that, in that they're taking this journey to get to the center of enlightenment, or the center of finally reaching their destination of getting the organ that they need. The hepatic labyrinth represents the data 1 and 2.7. People that are waiting in line for liver transplant actually receive that liver. And here each dot also represents 100 people. So no, each dot here represents 10 people, I'm sorry. And I've chosen to sort of take some of the internal representation of the organs, and this is where a medical illustration, I think, comes into this. Back to the kidney. So the grouping of the labyrinth inside the organ represents the inner workings of the kidney, and the arrangement of the pathways inside the liver represent the actual function of the liver. And if you look at a cross-section of a liver, the tubules and vessels that exist inside the liver have a similar look to them. And finally, the pancreatic labyrinth. And I was actually surprised by the pancreas being an organ that was transplanted so heavily. Not as heavily as other organs, but the 1 in 4 people receiving their transplant, I thought was a very sort of staggering number. And again, I've used sort of the surrealist, Dali-esque combination with the actual representation of the organ on the inside, combined with the numerical data. So this is something that I'm really pleased with so far, and I'd welcome any feedback. But right now, I think this direction is helping me to focus those 3 areas that I talked about, and I'm looking forward to pushing this further. Here you can see the 3 images in the end. So from here on out, I'm going to search for other data representing the health field, representing our health as a nation, our health as a global population, and see what other interesting ways I can come up with to combine these 3 areas and create new pieces. So thank you very much. Again, I welcome any feedback. If you want to get in touch with me, you can reach me at travis.vermilye@ucdenver.edu. So thank you very much for your time. I appreciate it, and good luck.